Welcome, everybody, to anxiety in the age of COVID-19. I wonder if there's anyone in this group that hasn't felt a little anxious over the last few weeks. Anyway, welcome. I'm Kate Fulb. I'm Director of Hollywood Health and Society, which is a program of the USC Annenberg Norman Lear Center. And Marty Kaplan, who's the director of the Lear Center and my boss, and I both welcome all of you to this panel and hope that you'll join us every Tuesday at this time. We'll be dealing with a variety of health and science topics around the issue of COVID-19 and how they're affected and changed. And we invite you all to participate and hear from our experts. For those of you who don't know us, Hollywood Health and Society is a free resource to the entertainment industry. We can connect TV writers and screenwriters and content creators with accurate information and access to experts in a wide variety of topics, everything from infectious disease and COVID-19 to HIV, to aging, to reproductive health, to criminal justice, climate change, and even nuclear weapons non-proliferation. So pretty much anything you might be writing about and you need to connect with an expert to ensure accuracy around your scripts, we're available to connect you with that information or those experts. And our services are all free of charge. We don't ask for a credit, and we don't ask for favors. So you can feel secure, safe and secure by reaching out. We are working during this time, so we have our operators standing by. You can shoot us an email. If you have questions or need to connect with someone, we'll be able to help you out. Couple of housekeeping things quickly. We are recording tonight's panel, and it will be made available on the Hollywood Health and Society website, as well as on the Writers Guild's website, both East and West. So if you have friends or other colleagues who aren't able to join us tonight, they can go and check out the discussion there. We're going to have Q&A at the last 15 minutes of this discussion. So, but you can submit your questions at any time through the little Q&A button down at the bottom of your screen. Just as you think of it, if you want to go ahead and submit it, and we have a couple of folks who are going to be scrolling through your questions and finding the ones most relevant or ones that haven't been later addressed through the conversation. But feel free to submit a question at any time, and we'll make sure they get asked. This is our maiden voyage of our weekly panel, so bear with us if we have any technical difficulties. Hopefully we won't. But again, welcome all. And I'm going to now turn it over to our moderator. Tonight's topic, as you know, is mental health, managing our own personal mental health during this time, as well as if you're writing for a project that may involve mental health in some way. We're here to help, and these experts are here to talk with you about it. So, but I'm going to turn it over to our moderator, who is the former president of the Writers Guild East and writer of Bill Moyers' Journal and Moyers and Company, Mr. Michael Winship.
Thank you, Kate. Thank you. Yeah, we're all doing this remotely, you know, so it's a challenge, but thank you so much. And good evening to all of you, and welcome tonight. As Kate said, this is the first of these discussions we plan to be having over the next few weeks about various aspects of the coronavirus pandemic and its effect on other health and societal issues of concern to all of us. And as she said, because it's the first of these, it's our shakedown cruise, so we hope you'll be patient with us if there's some, oh, you know, if the whole thing goes to hell, you know, we'll be able to deal with that, and thank you in advance for your patience. Kate mentioned it's being recorded, and we'll be doing Q&A at the end, so we look forward to your questions. I want to introduce our two guests tonight. Dr. Paula Cannon, rather, is a distinguished professor in the Keck School of Medicine at USC. She is a virologist who has worked on both HIV as well as Lassa fever and Ebola. She was the virus expert on the TNT series, The Last Ship, which was about a global pandemic. And also with us is Brian Shiers, who's a senior mindfulness teacher at UCLA's Mindfulness Awareness Research Center. So we have two really great qualified people who can address these issues and talk to us about mental health and talk to us about the current state of affairs with this pandemic. So for that reason, I want to start with Paula and just ask Paula to, in your capacity as a virologist, to let us know, give us any kind of updates that you know about, any new developments that you'd like to share, where we are with the statistics and that sort of thing.
Sure. Well, hi, everyone. And I understand that people are watching this and tuning in from all over the country. I'm here in Los Angeles, and there's very much a sense, I think, in LA that we're kind of in a bit of a holding pattern. We're sort of watching and waiting. We see the appalling situation in New York, New Jersey, Massachusetts, the high numbers of cases and deaths. And we're looking at, what's happening in our own state. California, the most populous state in the union. Our numbers are still kind of low. And what's not clear to me is whether this is just the calm before the storm, or whether, we kind of got lucky. Maybe because we saw what was happening in New York and other states, we learned lessons from that quickly. Certainly, the governor, and then here in LA, the mayor, I think have been very proactive in terms of calling for people to stay at home sooner rather than later. And maybe it's a stereotype, but I know certainly here in Southern California, you don't have to tell me to stay at home. I've got my backyard, I've got my barbecue, I've got my pool. We don't have public transport, so actually staying at home was not a hard sell, at least for the first few days. But now, like everybody, it's getting old. I'm kind of getting a little tired of the pasta sauce I bought in bulk from Costco. I'm kind of missing my friends, the cocktail hours every night for 2 hours on FaceTime, or the video chat is playing havoc with my mental health and waistline. And even as a virologist, even as somebody who kind of, feels I have a pretty good handle on what this virus is doing, I can read the scientific papers, I can look at the models. I have a lot of information. I have a high degree of comfort in thinking about this and thinking how to protect myself and my family and my friends. But I also have a high degree of anxiety because we've just not faced anything like this before as a society, and not as a modern society. And, the media we're getting all the time, the modeling, the guesswork, sometimes it's just all extraordinarily overwhelming. Again, even for somebody who kind of should know what's going on.
Yeah, I should say that I'm in Manhattan, that I am in the epicenter, and it's pretty staggering here. I live down in Greenwich Village, and the streets are empty, very little vehicular traffic. We have many hospitals that have sprung up here in addition to the regular hospitals and the hospital ship in the Hudson, and the Javits Center being used, and the emergency care center that's just up the street from me announced today that they were adding 31 additional beds to take non-corona patients to sort of ease the pressure on some of the other hospitals. So, and as you know, our governor has been, I think, dealing very well with the situation, but he said today, we have enough beds now. We finally have enough beds. It's just, equipment and personnel that are the issue here. Paula, why did this spread so fast? I mean, is it because so many people who have it are asymptomatic and we're exposing more people to it?
Sure, I think it spread really fast for two reasons.
Yeah.
One is it's infectious. Not all viruses are equally infectious. On the one hand, you've got probably the most crazy infectious virus is actually measles, which is why we say to people, get vaccinated against measles, because it just runs through communities. So this virus is kind of somewhere in the middle. It's more infectious than influenza, not as infectious as measles. Secondly, when a virus arrives that's brand new like this one, nobody is immune. Nobody's been vaccinated. Nobody has had it before, or even something similar. So we're all naive in that way. And so we're all potentially infectable. And then the third component, which we're still kind of trying to sort of get a handle on, is this idea that people can be both truly asymptomatic while they have the virus, and also as well as being what we would say is pre-symptomatic, meaning you could get infected with the virus today, Tuesday, and your symptoms may not show up until Saturday. But in the couple of days before your symptoms show up, when you're kind of, still doing things unaware, you can also be infecting people. So that kind of ability for pre-symptomatic or truly asymptomatic people to still spread the virus is certainly contributing to this spread.
But when people actually have the disease, the virus rather, why is the severity of the symptoms so different? I mean, some people have cold symptoms and some people are suddenly on a ventilator. Why is that?
Yeah, it would be great to know. So what we do know is that people who are older, people who are male, sorry about that, guys, and people who have other pre-existing conditions, in particular things like lung diseases, but also diabetes, are much more likely to have a more severe outcome. It doesn't mean you will, but that's the way the numbers are tracking. In addition, on the flip side, young people, people under 30, which apparently is the definition of young, have a much greater chance of having very, very mild symptoms. And some of the reasons for that are kind of counterintuitive. When people get the most severe symptoms, the cases where people have to go into hospital, this looks to be about 10 to 15% of cases. What we're seeing is that, in a way, people's immune system, the immune system that normally fights the virus and helps us, it seems to be getting hyperactive. It's like it doesn't realize there's an off button, and it's kind of throwing everything it can at the virus, and there is collateral damage. So that as we try to fight this virus, at the same time we are releasing things into our body that give us a fever. We do that because the virus actually doesn't like it when we're hot. We make ourselves hotter to try and slow down the virus. But at the same time, we release chemicals into our body that also have a side effect of basically making our lungs fill up with fluid. And so some of the really bad outcomes with this virus are actually a consequence of our own immune system kind of trying too hard. And I'm sure in the future we'll look back and maybe 23andMe, the next time you get a survey from them, it'll be asking you these things, and we'll figure out that there are some genetic predispositions that mean people would have these worst outcomes. But at the moment, it's just a guessing game. We can't.
We're hearing more in the last few days too about the prevalence, higher rates in communities of color.
Oh yeah.
Yeah.
Yeah, and the reasons for that are complex and must just reflect the social inequities around healthcare access, but also health in general, and the pre-existing conditions that make you more likely to have a bad outcome absolutely track with poverty. And if we didn't know that before in this country, coronavirus is absolutely brutally putting a spotlight on this.
Where are we right now in terms of testing, as far as you know, and also in terms of a vaccine? Are we really thinking like 12 to 18 months on a vaccine, and what's happening with tests?
Okay, so for testing, as I'm sure everybody knows, in an ideal scenario, the way we would tackle this virus is we would have testing available to anybody who wants it, and as soon as somebody was identified as being infected, we would immediately test all their family and their contacts. And the idea then is we could kind of corral those people, tell them to isolate, and these sort of, if you like, the initial flame of this fire could then be kind of kept under control. That wasn't available early on for all sorts of reasons, and not non-trivial reasons. We weren't prepared for this, and having companies make millions of different test kits is not trivial. We're getting better. I know, again, here in Los Angeles now, you can as long as you pass the criteria of being kind of pre-screened so that you do have symptoms, you can now go and get a test. And one of our large sporting arenas, the Rose Bowl in Pasadena, normally the site of much happier events, is now being set up as a large testing center. But and that's still going to be useful, but I think it's probably just a reasonable safe bet to say to people right now that if you get a fever, if you get a cough, if you start to, especially if you lose your sense of smell or taste, and there's a pretty high chance that you will have coronavirus. And even if you're not tested, please behave as if you do have this virus. Isolate yourself and do all the precautions that we talk about people doing. So in the absence of testing, I guess you can use some common sense. Michael, you also asked me about a vaccine.
A vaccine, yeah.
So again, wouldn't that be amazing if we had a vaccine? You know, even the people who don't think you should vaccinate your children are probably going to be standing in line for this vaccine. So there may be some good there. So again, the complication with the vaccine is as a virologist, when I look at this virus, I think, you know, this is actually going to be easy to make a vaccine. There's nothing that we know of that's particularly unusual or special about this virus. But the challenge is you want to have a vaccine that is effective. You know, not all vaccines work. You can inject them into somebody, and the idea of a vaccine is it tricks your immune system into thinking you've already been infected. Some vaccines, for reasons we never understand, just don't work. Secondly, of course, we have great concerns about, is this vaccine safe? Occasionally, extraordinarily rarely, but not zero, vaccines can have side effects. And if you start to produce a vaccine that you're giving to millions of people, even a tiny level of side effects is going to translate into a significant number of people who are going to show that. But then probably the biggest challenge is just the scale up and logistics. You know, there are clinical trials starting already of what we call vaccine candidates, so good ideas that we think might work, and they're being done with a handful of people. So if those clinical trials look good, you know, maybe a month or two from now, then, you know, just switching then to the sort of like scale up and production, how the heck do we grow millions of doses of this vaccine? That also takes time. So efficiency, efficacy, safety, and then thinking about the scale up are all challenges. And I think we will get a vaccine. I honestly do think we'll have a vaccine faster than the current estimates. And that's because there are some new technologies that have just come online in the last couple of years about making vaccines. One of them is making a vaccine based on messenger RNA. For those of you who want to Google that, you don't need to know the details, but just know that it's so much easier to grow that up in bulk, to have doses to give people. So if that vaccine works, that would save us, you know, 6 months in terms of production. So I'm cautiously optimistic. And of course, every biotech company, every academic research lab, you know, USC, everybody is trying to make a vaccine. And I've got to assume that with so many people trying this out, we will get one, if not multiple, good candidate vaccines. So stay inside.
Yeah,
stay
inside
inside
and these other drug therapies that are being debated and so forth, I would imagine it's somewhat the same thing in the sense of testing and
those are more challenging because although there are some candidate drugs, you know, you guys have probably heard hydroxyquinine has been suggested. There's also one called remdesivir. There's others that have letters and numbers, I can never remember them. The challenge of making a drug against a virus is that because viruses infect our cells and they sort of hijack our own cells to make copies of themselves, a virus is really almost like it's like a piece of us. So it's hard to find a drug that will kill the virus and not kill us. You know, it's much easier with bacteria. They're very different. So people are kind of trying antiviral drugs that have already been developed. They're looking in the sort of the medicine cabinet of previous antiviral drugs, including drugs that worked against influenza or HIV. And they're really just kind of crossing their fingers and saying, let's see if any of these, almost by coincidence, can cross-react against coronavirus. Again, though, there's a huge effort from both pharmaceutical companies and academic research labs screening, you know, literally hundreds of thousands of different chemical compounds to see if any of them have any effect against the virus. We've already identified quite a lot. The challenge now is to find those that can be given to people safely, that are not toxic, and actually have an effect on the virus. But again, every morning when I look at my email, there's news of a new, very small clinical trial, maybe a handful of people were treated, and some glimmers of hope. So I think we will start to have a menu of drugs that can work. And again, the challenge then will be, can we scale them up and can we get them to people, as quickly as possible?
Ryan, the COVID-19 story is just so overwhelming and complex and somewhat confusing. What are you seeing in your work as far as people reacting to the danger? Are they able to handle it? What's going on?
Well, Michael, as you might suspect, it's a wide variety of possibilities. Both as a mindfulness teacher for UCLA, but also as a licensed clinical therapist.
Yes, I'm sorry, I should have mentioned that.
But I get to see like the whole range of people, both people who are high functioning, who are struggling to adapt, as well as people who are, have clinical diagnoses this is laid on top of their current circumstance. One thing that I like to point out, and I think in a way this is echoed by what Paula shared earlier about how this pandemic really highlights some of the social inequalities that might be found in lower income communities. The pandemic doesn't create new mental states that weren't there before. What a pandemic is sort of like, it's sort of functioning the way a stress test was used to test our banks in the banking crisis and the housing crisis. What are the systemic cracks? What are the systemic issues that are there? You lay on this set of circumstances, and what we start to see is a highlight of what's already been there. So in many ways, what we're seeing are these exaggerated experiences of anxiety, worry, denial, obsession, compulsion, all kinds of interesting magical belief systems. I mean, it's been really running the gamut. And I think all of it's driven by this sense of a lack of safety. I say probably most people fit into that category. There are some people who are cavalier. Some of the early evidence that somehow if you're younger or totally healthy, this is just going to be a cough or a brief moment of wondering whether your temperature is up. But clearly we are seeing that, some people are in fact very healthy and they're getting serious illness. There may be a genetic component to that. So I think the fact that it's not as cut and dried as the way our minds would like it to be adds the levels of anxiety of the unknown, the ambiguous, the uncertain. And so that our brains hate that. Our brains are evolved for searching the environment for physical threats and for social threats. And when we can't get concrete, reliable information, it throws the mind into some disorganization and some tendencies, again, that were there before this happened, but now they're exaggerated.
Your mindfulness awareness center is really wonderful. The website's great, and I was wondering how you're adjusting those programs, or if you're doing anything differently to adapt to this sort of unforeseen crisis that we're having in terms of the people that you're talking with and helping.
Yeah. We're really, first of all, what we did very early on was we folded up our classrooms and started offering all our classrooms via Zoom. We knew we couldn't maintain a 6-foot distance. I had just started a 6-week series and was one day into it. In fact, I remember it was actually a class on positive emotions. And my opening line was, I'd like a round of applause for teaching a class on positive emotions against the backdrop of a contentious election year and the announcement of a pandemic. And so it was sort of like a suicide mission. And then that next Monday, we got word that we had to close down. So we started right away on Zoom. So we're offering classes via video, and we're offering a number of drop-in meditation practices that are free to the public. And just for people who might want to know, if they want to write it down now, it's uclahealth.org/M as in mindful, A as in awareness, R as in research, C as in center, mark. So yeah, we're offering lots of different programs. There are also a whole bank of free meditation recordings that we've done over the years that are available. So it's a pretty great treasure trove for folks who are interested in trying to find practices that suit their mood and their need in the moment.
Is there a way to turn anxiety around and use it creatively? Are there creative ways to use it?
Yeah, that's a great question. And the truth is that we need anxiety. We need anxiety because it's a motivator to act. And so the question becomes, you know, how do I, first of all, recognize my anxiety in the moment? And is there a way to optimize it, right-size it, so it serves me as opposed to immobilize me or drive me to behavior or, you know, physiological states that aren't helpful or healthful? There's one of these big issues that's true right now that I know I've read many healthcare providers and psychotherapists are worried about. It's health anxiety. Health anxiety is this concern that, oh, this tickle in the back of my throat. Oh, I've been lying in bed and tossing and turning, and now I have there's some heat around my body. Maybe I have a fever. And so the anxiety creates sort of a lens through which I interpret information. And that lens can be driven by projections and predictions that are fear-driven. And so I can actually get myself to a healthcare provider without ever having actually any real symptoms. Or I can actually worry myself into symptoms where I'm actually suppressing my immune system and making myself more susceptible if I do get exposed to it. So they're not ideal conditions. So what we can do is, first of all, with mindfulness, which is a skill of refined attention, sometimes we call it meta attention. It's attention that is not entirely absorbed in the current thought of the moment, whatever that is. It's attention that is active and observational. So if we learn how to do this through a skill practice, we're much more aware of body signals, and we start to develop a much better tracking of our own body maps so that we can start to notice when things really are different or if it's really just coming from more of a cognitive approach to my experience. So I can start to sort through my sensations better. When I start to recognize that I'm getting anxious, so for instance, you know, you might have very particular ways that anxiety shows up for you. For some people, it might be kind of tightness in the throat. For someone else, it might just be a really quick tempo. They tend to, you know, knock things over, or their hands are less precise, or it's something around that nature. But I need to know what my signals are that I'm getting anxious. And in that moment, it's really important to notice, well, what thought process is happening in me? Am I imagining my 401k disintegrating? Am I worried about my elderly grandmother? Am I thinking about what happens if this doesn't end until January? You know, what is the thought that was there just before I noticed this shift in my body or shift in my functionality? Now, the trick is that we have such a disconnection with our bodies that there's a feedback loop that feeds into the experience of anxiety that is unhelpful. And when we're getting better at using our awareness and body knowledge, we can kind of cut that feedback loop. So it might work something like this. Maybe I'm reading the latest Johns Hopkins newsletter about you know, data and updates about the virus. And all of a sudden I start to notice that it seems like we're getting ready for this terrible wave of mortality. And I just start to notice that my chest gets tight. And what I'm noticing too is that what if it hits me? So these are normal, natural thoughts. We are always at the center of our world, and we're always wondering what's going to happen to me. So this is a normal thing that's being brought out by these conditions. But what happens is when I start to have this terrible thought of what would be like for me to be ill, and then I notice body sensations, I didn't choose the body sensations. They're happening to me, but they're happening as a result of my normal thought process. Because these body sensations are there, and because I normally don't notice my body sensations unless there's something wrong, or I have to eat, or get up and move my leg because it's falling asleep, or use the restroom, now I'm noticing there's something wrong. And that, to the person who's not clear about how this tends to work, is confirmation that my thoughts about my imminent danger are actually true. When I notice my heart's beating, I feel like, oh my gosh, I'm really in trouble. I really could die. This is terrible. And so it's an understandable way that we respond to both my own thoughts and my body. But of course, when we look at it more objectively, this moment I'm sitting in my chair, I'm looking at my laptop, I don't have a fever, I don't have a cough, I haven't been diagnosed with anything. What's happening is I'm projecting into the future, and my body, relying on my brain and my cognitive processing, is responding to that threat. And so it's getting ready for fight or flight or freeze. And so because I'm not aware of my body responses, it seems like my body knows something I don't know. And so now I'm really frightened. What I really need to do is actually first come to, and this is why mindfulness, we start with body awareness. I start to relax my mammal body, because all it's doing is following my thought process. So the first thing I want to do is calm my body. So I might need to get away from the laptop, take a stretch, take a breath, get a glass of cold water, maybe splash cold water on my face. Maybe because I'm getting familiar with this is a thing that I go through frequently. Maybe I need to do some yoga or do some push-ups. But I do something to discharge what I've actually inadvertently asked my body to take care of, which is to fight or flee. Let that discharge happen. I'm doing it in the context of, actually, I'm safe right now. Actually, nothing is going on. I've just gotten my body all worked up and ready. And it doesn't mean it's true. It just means that my body listens to my mind. And then I will go and correct my thoughts by thinking about, you know, is it worth putting my body through all this stress by imagining what happens if I get sick? If there's something creative that comes out of it, like maybe I need to make a plan with my wife and give her my requests about, you know, medical care, or maybe there's an issue I need to make a phone call to, you know, a business person or something else. But if it's not a creative, strategic future, imagining my psychological future where I'm suffering doesn't really help us in terms of the present moment. So we want to really start to look at that cognitive process once we calm the body down.
Somebody said to me, something I read actually, talking about the idea that there is a tendency to extrapolate from the global crisis onto yourself. That you take the global situation, which sort of planet-wide is more dire, and then take that upon yourself, and that increases your anxiety.
Sure. Well, you know, this is something that the mind does all the time. We, you know, in the study of interpersonal neurobiology, which I'm trained in, it's this idea that the sense of self that we have, which includes my overall perception of my body, and it includes my internal states, and includes my thoughts and stories about who I've been, what I'm doing now, who I will be. It's intertwined with lots and lots of humans. There are all kinds of characters in my thoughts, people, friends, family, coworkers, strangers, and my sense of the world. So a big part of the self is constantly weaving in others into my narratives. And that's one of the ways that we create self moment to moment. So it makes sense when I see this larger threat, I'm always at the center of my drama, of my story. And I am a confluence of my own experiences and my way of inferring from others.
Yeah, I lived not far from Ground Zero, and I was here for 9/11 and had great anxiety, which a therapist friend of mine described as, she said, you're having a normal reaction to an abnormal situation. And what I found consolation in was writing about it, was writing about the situation. And sort of journaling it and publishing some of it and so forth. And I can imagine that a lot of the people who are on this call could be contemplating the same kind of thing, and it might be therapeutic, wouldn't it?
It's very therapeutic. And, you know, part of it is, you know, in a situation like this, and Paula was describing it so beautifully, there's so much disruption in our ordinary daily rhythms, our hourly rhythms. You know, many people are having a hard time remembering what day it is, what time it is, if they're not scheduled. There's also there's misinformation, there's conflicting information from good sources because we just don't know. There's so much uncertainty and ambiguity that to write down my experience allows some concretizing. It allows some clarification. It allows some externalizing. So I'm not necessarily holding it, because as it's sort of swimming around in this cognitive soup, as I'm moving through my day, trying to figure out how to spend my time, it's not clear. But when I clarify it and I externalize it, and I don't have to carry it around so much, and it actually can also lead to a sense of purpose, to a sense of meaning, to a sense of a larger connection with maybe your values or your history, your heritage, your nationality, your purpose, whatever it might be. It can really dive into that and be a powerful, powerful way of coping.
Are there other ways that members of the creative community can better manage our stress and anxiety right now? Are there other methods?
Absolutely. So I made a whole bunch of lists of things. So first of all, optimizing your health and well-being is really it's a resource of resilience. So doing your best to sleep as much as you can, get optimal sleep, good nutrition and hydration, and exercise. That's really going to go a long way towards helping you feel better. Remember, if your body is sort of the kind of canary in the coal mine for your stress, the lower your resilience and resources, the more acutely you're going to feel that stress. And so we want to really have a great reservoir. Doing meditation practices, the mindfulness practices, there are all kinds, including, surprisingly, one of the most powerful meditation practices for yourself is what we call compassion practice, where I'm actually visualizing an individual or a group or the planet as a whole even, and wishing well-being, wishing safety, wishing care, wishing people get what they need, and really actively visualizing that and sending it out to the world. There's no magic there. There's no actual pixie dust that's traveling the globe to some other remote location, but rather you're tapping into your natural connection for human flourishing, your natural wish for people to be safe, and it really grounds you in your own unique goodness, and found to really enhance the immune system and actually increase affect, positive affect. Scheduling your day is actually very helpful. You know, looking at your day and creating a marker hour by hour and deciding, you know, it doesn't have to be rigid, but it's the idea of projecting into my day. I know what this day is. I know what I'd like to accomplish. I know who I'd like to include in it. That's very helpful. Doing things what we call like a Zen master. So in dialectical behavioral therapy, I'm a therapist at a place called WestSide DBT, and we practice dialectical behavioral therapy there. And among the many different skills we teach people is this thing called being one mindful about something. So for instance, if you're anxious or you're feeling scattered, if you're doing the dishes, if you're doing laundry, or if you're you know, organizing your bookshelves like I did on Sunday, try and completely saturate your attention with what you see, what you feel, and what you hear. So I'm really taking in the sensory. There's less room for rumination, less room for imagining difficult things, problem solving that really can't be done from the home. I'm just going to be really with the thing I'm doing. And it's incredibly grounding, and it develops more presence and more awareness. Building mastery is another skill we teach. So take out an old skill and polish it, or learn a new skill. I'm going to be learning how to play guitar starting this coming weekend. There's an app online that I found that's on my phone. It's going to teach me how to play guitar. So learning something new is very powerful. Staying in contact with people, however you do that. Even mailing letters to people, that's been old school, brought back because it's kind of lovely. And then being of service. You know, how can I actually help someone? So even if I'm, you know, I wear a mask whenever I go grocery shopping. And I started that very early on, but I smile with my eyes. I nod to people, or I cross my hands over my chest when someone's passing. I'm trying to offer kindness and connection, and it just makes me feel better. And so however we can find ways of being of service is really powerful. So that's kind of a list of things that.
That's great. Paula, both of you, Paula and Brian, are there aspects of this story that you think are not being adequately covered, that aren't being given enough attention to, that maybe some of the people on this call could address and help increase coverage?
Well, I think to pick on something that Brian was just saying, just the absolute power that individual people, even in an apartment with a bad Wi-Fi connection, your power to do good. I mean, I love Brian's suggestion of sending a letter. I mailed a letter to my neighbor because I just, I had these kind of cards I got, and I just thought I'm going to send it to her, and it'll take 24 hours to get there. But she'll smile because she knows that I'm thinking about her. Reaching out to one of my most fun things I do is when I call one of my local restaurants to order takeout food, and it's not transactional. It's not okay. I want the lasagna. It's like, how are you guys doing? What are you making today that is easy for you, that I can take off your hands? Can you throw in a bottle of wine? are you finding a way to tip, you know, the wait staff who I don't see anymore? I have these kind of little conversations with them, and in my small way, it both, you know, feeds my need as a human being to feel like I'm connecting out. It puts a layer of normalization on what is a very abnormal situation, and it makes me feel like I have the power to affect change, no matter how small it is. I think Brian also talked about going to the grocery store. It's one of my favorite things. Just before this whole pandemic blew up, I was actually in Thailand for a week ironically, at a scientific conference about emerging viral infections in Asia. We did not see this coming.
Wow.
But I learned to do this, and I thought, what a beautiful gesture. And so now, you know, in the aisles of the grocery store, partly also as a way of saying to people, keep back.
Yeah,
kind of like,
right.
you know. And so I feel like I'm learning a lot of non-verbal communication skills that I haven't had before, and they transmit across these 6 feet of distance between us and our different houses, and just remind us all that this will pass, and the way that we behave during it is going to say so much about how we are going to emerge from this at the other end, and indeed how our society is. I'm kind of an optimist, so I see the silver lining in this, but I think, you know, I've loved listening to Brian there, because I'm just like, these are new things I'm going to do during this period.
Well, you know, Michael and Paula, there are 2 things that come to mind quickly. One is, you know, I work with a lot of teenagers, and they're climbing the walls when their parents are really instilling the basically house arrest. And one of the things that's true that they're learning that is really important to recognize is that as they have all the time in the world to do FaceTime and Snapchat and Instagram, and it's not enough.
Yeah.
It's not enough. They're craving being next to each other. And that is huge. They're recognizing that there's something that happens when my body is next to your body that can never be captured, even by Zoom, right? So that is really a wake-up call to a lot of teenagers who are realizing, I want to be with you. I don't want to be stuck on my device, because now I'm stuck on my device and I feel alone, right? That's the first thing. The second thing is we really need to just recognize how judgmental we are in this situation. We are so judgmental of others, and we're so judgmental of ourselves. I have a woman who is extraordinary. She's a gifted artist, married to a big rock and roll family, who shall remain nameless. And she is really struggling with a lot of self-guilt, because she wants to reach out and help lots of families that are not able, that they don't have their resources. Her husband is in a kind of a place where he is in a scarcity mindset. So they haggle about what is possible. She wants to put herself kind of out there in the community and actually expose herself to things. She's kind of driven by that. But then she has this other piece of herself, which is she recognizes that she wants a little recognition for it. Not like in the newspapers, but just like she realizes when she sits quietly in our mindfulness practice, she recognizes there's a part of herself that wants to be seen as an altruistic, good person. And for her, she judges that. She says, oh, it's not pure. My out giving is not pure if some part of me wants to benefit from it. And so we have to work to reconcile that we have lots of different parts of ourselves. And the act of giving, you have to be a saint not to recognize if someone says, oh, thank you so much, that's so generous, not to receive that compliment and to allow it to be there. And so she's kind of tied herself up in knots, judging her husband's scarcity, judging her own, you know, maybe risking herself getting sick, judging her own need to be altruistic and be acknowledged for it. So we're working how to relax this judgmental mind and accept all the facets of who we are and realize that this is a very, again, it's a stress test for our minds, our bodies, for our economics, for our relationships, our communities. So
I had to learn how to not be judgmental as a virologist. Like early on when people were like, oh my God, when an Amazon box comes outside, I like spray it with bleach, I set fire to it, I leave it for a week, and then with hazmat suit on, I pick the thing out, and I'd be like, I just bring the Amazon boxes in the house. I mean, I don't lick them, but I'm not kind of freaked out by this. And so it's been a journey for me to think about how to help people think through the fears and the anxiety they have over things coming into their house, takeout food, Amazon packages, grocery deliveries, and to try and help people understand enough about the virus, and also just the improbability of certain situations, so that they can find a practice that fits in with their own what's going to make them feel good. And for some of my friends, I'm like, have at it. I know you are going to wipe down every single can of beans with Lysol wipe and quarantine it for 48 hours in a different part of the house, and that's okay. Other people are like, well, I'm gonna leave the outer bags outside. I'm gonna bring everything in. I'm gonna wash my hands, and then I'm just gonna get on with my day. So I think recognizing that not only do we not know, but as we all craft our own personal version of how we deal with this uncertainty and this anxiety, whatever works for you. If it's Lysol wiping the can of beans, go for it.
Well, how do you all feel? Do you both feel, given that those of us who are writers and part of the creative community, I mean, what can we do to best help? I mean, how can we best use our skill set to help with this whole situation and to help other people?
Yeah.
I'd say take the focus off the virus. At the moment, we see this sort of existentialistic alien threat, this virus. And actually the story is not the virus, is it? The story is what the impact it has on our society and us individually. But actually the more important story is, how do we react to that? So I think you said in your introduction, I worked as the virus expert on The Last Ship, which was, a very prescient TV show. I recommend you stream it. But there have been a number of shows about this, about pandemics, because we all knew this was a possibility, and still extraordinarily, we weren't at all prepared for, fiction to become fact. So I think I would say to writers that, you have the power as you're writing these stories to look beyond the actual element of the virus, and instead teach us what it is revealing about our society, both the good and the bad. And maybe we come out at the end of this, I would hope, more thoughtful, more kind, more appreciative of other people, and also quite frankly, better prepared to face the next stress test, because it's coronavirus this year, but gosh, again, I'm in Los Angeles, so that a major earthquake is now at the back of my mind. And if nothing else, I do have a lifetime supply of canned beans to get me through that. But I'm also starting to think about what are the other resources in myself and in my family and my friends that I need to be taking care of and building up, so that we can respond with kindness and appropriately to pretty much whatever is going to.
I have a quick offering around that, because one of my clients is an MD working for a major hospital here in LA, and she needed some real counseling because she was finding a lot of anxiety coming from both the fact that her husband had been tested positive for COVID-19, but also they're rationing the testing kits as they need to, because they need to test more in more extreme cases. And so one of the things that came true with her case was that she didn't know how to be. She was losing touch with her sense of self as a physician. And so sometimes what I do is I bring in, kind of mythological archetypes of, what form of heroism do you see yourself capable of performing in this crisis at a medical center where you're working in an ER, And so one of the things she pushed back on me, she said, well, I don't see myself as a hero. I just don't. I just do my job, and when people call me a hero, I feel really uncomfortable. And I said, well, have you ever heard of the Taoist masters in China? The Taoist masters really believe in becoming kind of invisible. They might be a mendicant in the street or a simple shopkeeper. They have tremendous spiritual and medicinal knowledge, but they'll never let you know about it. They'll just do good works because they don't want to draw attention to themselves. I said, maybe you could be more like that. And she loved it. And she because it didn't draw attention to herself, right?
Yeah.
So what I would say to writers is look at all the different archetypes, because one of the things I mentioned earlier about interpersonal neurobiology, right? We tend to not only create a sense of self through our relationships, but we also model without realizing it, other people. So as many models as we can get into characters and stories about how to be both human and flawed and courageous in crisis. People really, I mean, that's why I think this entertainment business is so powerful.
Mm-hmm.
That we live in stories all day long, and we need models to show us how to do this. And so the more you make really human characters who are showing a range of possibilities, I think it'll be very powerful.
I want to go to a question or two from our viewers, but before that, Brian, I think you had a short exercise you wanted to share with everybody.
Sure. We can do something
to help.
quickly. Yeah.
Mm-hmm.
So we're going to do just a simple. Sometimes we call it a check-in, and you can do this anytime. You can do it formally, like we're going to do now, because we're all knowing it's happening, or you can do it on the fly. Maybe you're walking from your bedroom to the kitchen, and all of a sudden you just realize you have a tightness in your throat, and it's affecting you today. And so you can just stop right where you are and do this. So I'm just going to use a little chime here just for fun. And so you can just be standing or sitting, just get comfortable, and you can just gently close your eyes and listen to this sound. See if you can track this sound and follow all the way till it's silent. And just notice what it's like to have your eyes closed, and there's a feeling of being inside, right? I'm kind of behind my face and within this body. And I just take a deep breath. And as I exhale, I try and relax as much as I can. Whatever I'm aware of that's tight, I try and let it just sink down, let gravity do its work. And I begin to bring my attention, which is really it's like a filter of my awareness. It filters in some things and out others. So filter in just the sounds around you. If there are any sounds in the room where you are, just let them naturally waft over. And now filter your attention to take in the sensation of the skin around your face. Just notice if it's tingling or feels alive, feels warm or cool, tight or relaxed. If you notice any muscle tension, just soften it. Notice if, as I speak, images come to mind. Those images are just a form of thought that the brain automatically associates. Gently let the thoughts just kind of be there, but bring your attention now to your chest, and notice if your chest moves as you breathe in. And as you breathe out, see if you can sense the movement as a felt touch. And on that exhalation, see if again you can let go of everything that is in the torso, any kind of tension that isn't necessary to hold. And sometimes when we do this, it's just really calming. Other times I notice that my mind is chaotic or busy. It's not a problem. The only thing I need to do is just notice how things are, and then really fix my attention to my body. So now moving down to the belly, and just noticing if there's any movement when I breathe in and breathe out. I'm not trying to see it in my mind's eye. I'm letting all that go, just feeling the belly, breathing in, breathing out. And just taking now just a whole sense of my head and my torso. It's here, and I'm safe, and I'm well. I don't have to let my thoughts pull me to the future or ruminate of the past. I can just be right here. I can choose to be in this moment, or I can choose to be in these other places of time. And just to finish this practice, I can just think of one thing I'm grateful for. It could be really simple, that I'm just here right now with you, or it could be something bigger. There's one thing I'm grateful for. Bring it to mind, see it. Maybe say it to yourself. Our eyes. So this is sort of a little practice just to stop and check in, get familiar with the body, breathe, relax the body, connect with the autonomic nervous system, and then notice the relationship to thinking, try and stay with the present moment, and then use thinking to connect with meaning, purpose.
Great. That was lovely and very helpful. I have a question here from someone named Scott, who is asking, how do I get myself out of a state of prolonged freeze where I'm unable to think clearly so I can help navigate myself back into calmness, clarity, and lucid action?
Yeah, wonderful. It's going to sound surprising, but if you take a big bowl of water, fill it up, put a lot of ice cubes in it, stand over the sink or over the counter, take a bunch of deep breaths, hold your breath, go under, dunk your face in. When you have the urge to breathe, don't hold too long. Don't panic yourself. Just when you have the urge to breathe, come back out, breathe several times, do that 15 times, and your whole autonomic nervous system will reset. It's extraordinary. We use this all the time for people with borderline personality disorder who are highly dysregulated. They get frozen. They get, absolutely, inflamed with emotion or shut down and dissociative. This brings the system back online. It's really remarkable.
And I'm sorry.
I'm going to say I'm going to try that. So
Yeah, exactly.
do a number on my makeup, but apart from that, yeah.
Well, Paula, here's another one. For those of us who, this is from Jeannie, for those of us who have aging family members in nursing homes or loved ones with intellectual disabilities living in group homes that we cannot take care of alone, how do we reconcile that we can't do very much to help them?
Gosh, yes. So maybe one approach is to if you call, the managers, the owners, the caregivers in the home, and convey that sense. They are your go-between people. So maybe you can share something with a caregiver. This is what I know my mother likes. This is what my father would talk about. Maybe use those caregivers who are also under extraordinarily difficult circumstances at the moment and use them as sort of avatar almost. If you're also feeling just anxious, and I know I have friends who have family in care homes who are very anxious about the situation, speak to the management and ask, in these extraordinarily difficult circumstances, what are you doing to, protect your staff and your patients? What sort of new practices are you putting in? And then, honestly, I keep coming back to this idea of, is there anything I can do to help? Are you running out of something? I can maybe find a delivery for you. Is there something that I can give to some of the caretakers? I was actually online the other day realizing you can still buy flowers and you can send flowers to people. And I thought, there's somebody I'm going to send flowers to.
Yeah.
So I think, again, just bridging that connection and recognizing that maybe the people that we've taken for granted in the past, the behind the scenes, these essential workers who are looking after our parents, bringing our groceries in, maybe we've now got permission to kind of rediscover our humanity by recognizing their humanity.
Mm-hmm. Yeah, it's beautiful, Paula. It really is. Yeah.
Anything to add to that, Brian? Or?
Yeah, I think that's really practical. And when it seems like there's nothing, again, I think it's two things. One is this, both this woman named Marsha Linehan, who created dialectical behavioral therapy, as well as another therapist named Tara Brach. They both embrace this notion from Buddhism called radical acceptance, which is this full-hearted acceptance of the difficulty of the suffering around that circumstance or whatever circumstance it might be. So I want to, first of all, just open my heart to it because it's just true and it's heartbreaking. And when we don't allow ourselves to fully experience that, it ends up not being digested, as it were. So radical acceptance is this truth of the beauty in this and the suffering of mankind. And then this other practice that I mentioned earlier of just sending well wishes. I imagine my grandmother or my grandfather or my father or my mother and wishing them well. It creates a kind of connection. It evokes that relationship in the mind body, and it does bring some solace. It's a remarkable practice that even when someone has been lost, I do it for my mother who passed away several years ago, and it just evokes a feeling of connection. The connection is a real thing. It's in my nervous system, and it's not manufactured in the sense that it comes from decades of impressions, decades of experiences together. So I can invoke that as a comfort and as an affirmation of that relationship.
I want to wrap up by asking you a couple of final questions. One of which is, what do you two think are the best sources of information for all of this? Because there's just such an avalanche of data and news and information that's just flooding over everybody. What do you find are the best sources, the best places to go?
Mine's pretty short. I used the Johns Hopkins Center for Health Security.
Okay.
Letter. Yeah.
Gosh, I'm a news junkie, but I think that the coverage in the New York Times, the LA Times, the British newspaper, The Guardian, has been outstanding. And I'm a big fan of Vox. I think their reporting has been really good as well.
Yeah, you sent me a great piece from them the other day.
Yeah, they've done really good things. So, I think, be an informed consumer. The clickbait stuff. Oh gosh, I'm talking to writers. I don't have to tell you guys this, but when I find myself about to click on that kind of salacious heading, I go, no, I'm not going to do that. And also, I think again, that some of the state and the city websites are very informative as well. I check out the one for LA frequently just to sort of find out what the latest thinkings are. And then, if you're watching people on TV, I'm not going to mention any names, but there are certainly some people's press conferences that are more informative than others. So, I think, Mike, in your city, your mayor does fantastic conferences in my city as well. You can get not just accurate information, but seeing thoughtful people kind of discussing these things, a sense that, although it's evolving quickly, new things every day, finding a source where there are people that you feel are also in the trenches with us and also trying to make sense of this situation and are not going to, lie to you for rating.
I was going to wrap it up, but I do have a couple of other questions from people who are watching this, and I'd like to get them in. One of them is, how do we talk to children about losses in the family and extended family that are happening right now? And people who don't want kids to know necessarily. I mean, how do we deal with that?
Yeah, well, that's a very complicated question.
Yeah.
That can't be answered simply, but you have to take into account, first of all, the developmental age of the child, right? What you say to a 5-year-old is going to be very different from what you say to a 12-year-old. So there's a lot of, and then, there are some 12-year-olds who are like 8-year-olds, right? So you have to really look at who your child is. You have to look at your values, your family values. If you have a faith, if you're not a faith-based family, there are a lot of questions around that. So it's complicated, but, I think you have to really look at that cost versus benefit analysis when there may be some factors that really do complicate the matter, and it might be better to wait. Other times it's important to do it because the child senses it in the family, in the household. And without knowing what that is, the child could internalize it in a way that's not helpful, mistake what it's about, or maybe blame themselves. There's all kinds of issues. It's very complex. My suggestion is to get the help of a therapist to navigate that.
Yes. Okay, and then is the COVID, and this is probably more for you, Paula, is the COVID-19 pandemic fitting in with the models you are familiar with, and does your community anticipate more frequent pandemics going forward?
Yeah. Yes, we do. So I think, one of the features of this current virus is that we know it came from an animal somewhere, probably bats. It's kind of gross, but almost every animal on the planet is carrying like its own group of viruses, and most of the time they stay in the animals and our viruses stay in us. but occasionally they'll jump from the animal into the human. And that's when we get these explosive epidemics or worldwide pandemics, because humans have never had this virus before. So I think, not just with COVID-19, but in 2003, we had SARS, which was, a very similar virus. So now that this has happened twice in our lifetime, we should expect this to happen kind of, with some regularity. The good news is that I think a lot of research now is shifting from the idea of trying to develop a drug or a vaccine against, one virus, to instead looking at approaches that are going to give us weapons that we can use against kind of any virus that emerges from this family. So I'd be cautiously optimistic that, again, as a result of what we're seeing with COVID-19, we'll end up with some great drugs that work against a variety of viruses, and we'll have learned our lesson about stockpiling things. So hopefully we'll be ready for the next one. But yeah, I think there will be a next one.
Brian, how do we go back to the kids? How do we reassure them that they'll be safe and explain how their world's been turned upside down? That was from a viewer.
Yeah, I think, it's interesting. It touches on what Paula was talking about with sort of creating more, what's the word I'm looking for? More tolerance, more acceptance of people's, hypervigilance. The most powerful thing we can do for our kids is be a model for calm, for reason, and for regulation. Right? Mm-hmm. So first of all, I got to take care of myself. The more I can regulate, the more my children can relax. Explaining to them the very basics about the most important things we know are about, if we're going to go out, we're going to keep that social distancing, really cognizant. We're going to be mindful of that, right? Stay aware of that. And we're going to wash our hands. We're going to be aware of not touching our faces. Those are the three things that can help us the most in this situation. So I'm going to help by simplifying it and not overdoing it. Also being very aware of how much I'm talking with other adults, whether it's through video or on the phone or reading news out loud or talking to the other adults in the house, because they're hearing things. And so being really cognizant of how much I'm sharing difficult, hard to understand information that's scary. So really having some cognizance of how it's affecting other people is really important. But keeping it simple so that, at least for them, there's less ambiguity, there's less frightful boogeyman kind of feelings. And for the teenagers, it's really tough because when they hear that this could be lasting through May, maybe into June, who knows, right? That just is such torture. So there it's really about trying to go through some of those other practices I mentioned where we're trying to engage them in building masteries, and connected, doing things for other people, practicing mindfulness, things like that.
Well, going back, we were talking a little bit before about sources of information, and the World Health Organization put out guidelines last month suggesting that some people should limit their viewing of the news to once or twice a day for their updates. So,
sorry, Paul.
how do you recommend?
Didn't get that memo.
How do you recommend balancing staying informed with not consuming so much news that it adds to anxiety?
Yeah, I think that's the whole idea, right? Mindfulness is it's this word that reminds me to pay attention to not just what I'm thinking, but how am I thinking? How am I functioning? What's my body telling me? Mm-hmm. Moment to moment throughout the day. So if I notice that I'm reaching for the news and it feels like I've done it 10 times, stop and just do what we did together. Just feel into the body. What does it feel like mm-hmm. right now? Mm-hmm. Do I really need to do it again? And I weigh it out, because there's no hard and fast rule. Only check 3 times. I need to really know what's true for me and what's true for me today versus yesterday. And that requires more flexible awareness and discernment, right? So mm-hmm. that's what we're searching for, is not hard and fast rules that I don't break, but rather, checking in with myself throughout the day and seeing, do I feel better when I stay off, my phone, mm-hmm. or stay off the news feeds? What is it like? Try it for half a day and see what it feels like. But you can only know through experience.
Okay, Paul, I have to ask you this because we got a question, which is about mm-hmm. the Bronx Zoo tiger and the COVID-19. Do you think we should be worrying about our pets?
So this is complicated, and so first of all, full disclosure, I have 3 cats. The fact that this coronavirus can infect other animals, including tigers, and possibly domestic cats is not actually that surprising. A lot of these viruses will infect other animals. It clearly doesn't seem to be, rife throughout cat communities, and it's not killing cats, so it's not going to be a major problem for cats. Having said that, in light of this information, what I will do is, if I am unlucky enough, if me or my husband do come down with coronavirus, heartbreaking as it will be, part of my sort of isolation in our house as somebody who's trying to, for example, not infect the rest of my family, I will also say, please don't let the cat come into my room, because I wouldn't want to pass on the virus to a cat. I think it's unlikely. I think
Right.
they're kind of accidental hosts. They're not going to be driving the pandemic. But it just seems like another thing I can do in the same way, in the same courtesy and love I showed in my family. I would always also extend that to those rather, kind of supercilious creatures that don't normally pay any attention to me. And really won't appreciate it either.
How do we, when this is over, when we finally come to a point where we can emerge from our apartments and homes and so forth, how do we ease back in most mindfully? How do we do it?
Yeah, well, I think the first thing is to listen to the guidelines from our epidemiologists, our medical community,
Yeah.
and our civic leaders. So really being aware of what that looks like and being vivid about it. And then the other thing is to, while we're cooped up in our homes, what do you envision? How would you like to be?
Mm-hmm.
What qualities would you like to bring to your relationships, if you have to restart your business, how are you going to do that? What would it be? Start reinventing certain things now, or if you are returning to your business because you're working from home, you're going to be going back to an office. What would you like to change about how that office functions or how you function in that office? So I would say really trying to be generative and think about what could rise from the ashes out of this decimation that the economy is going to experience, that many people in the service and hospitality industries are going to experience, retail. How can we participate if you're lucky enough to have resources? Because like I'm able to work fully from home. I'm working full time from home. I'm extremely grateful for that being the case. I want to participate in building that economy back. So there are all these different ways you can start to think about and maybe make a little journal about that are specific to what you wish to contribute and what you need to rebuild. But getting generative now rather than waiting, so that it kind of builds in your imagination and gives a sense of purpose.
Paula?
And I think what I would do is I would hope that I can always remember and hold on to the experience of this time and this kind of new appreciation. I think so many of us have found for our friends and our family and the outdoors and all the things that we're starting to appreciate. I would hope that I can find some way to kind of distill that and hold on to it, and that a year from now, 10 years from now, I will be a different person and I will behave in a different way because of going through this experience, because there's got to be a silver lining to this. There really has.
Well, Paula and Brian, thank you so much for this. It was so incredibly informative and illuminative and just terrific. So thank you for that. I want to thank Kate Volb and everyone from Hollywood Health and Society for making this possible tonight, and my colleagues from the Writers Guilds East and West. Next week on the same day and time, Tuesday, April 14th, 8 p.m. Eastern, 5 p.m. Pacific, we're going to be talking about COVID and issues of addiction, treatment, and recovery. We'll have with us Dr. Leo Beletsky, who's Professor of Law and Health Sciences and Faculty Director of the Health and Justice Action Lab at Northeastern University, and William Cope Moyers, who's Vice President of Public Affairs and Community Relations at Hazleton Betty Ford. So I hope everyone can join us for that, and I wish you good night and good health, and thanks for watching us.
Thank you so much,
everybody.
Yeah.
Thank you, everyone. Please look for an invitation for next week and let us know if you want to join the mailing list, and we'll sign you up. Thank you, Michael, for moderating, and thanks to our two guests. Have a great night.